everybody. This is my fourth baby, Rune Winter. He was born on January 1st of this year, and he was born at home. And he's going to sit with me today, hopefully, while I chat about midwife care. So to me, at this point, obviously as a midwife and having had 3 home births myself, the care that you get from a midwife is awesome, but something I know really well. So when I meet moms that have had hospital births, whether it's through an interview or just kind of in passing, I'm always really surprised at how little they know about what midwifery care is. So we're all focused on home birth, and home birth is wonderful, but the real difference to me is the care you get and the care that I provide along the way. So that's 10 months of care, of which the birth is a really important part, but there's tons that come before that, and of course there's tons that come after that. So the first thing I like to explain to people is when you hire a midwife, actually when you hire me, which is how I'm going to put this whole thing, just because I know my care the most intimately, right, Rune? Right? When you hire me, you get me 24/7 every day of the week until your baby's born, and then even after. Who wants to nurse here? So if it's something major, of course, I wouldn't mind a phone call at 2 a.m. But for minor concerns, I'm still available, and by email as well. So that's always a huge difference to people that are used to doctor care and not even being able to get a hold of their doctor on the phone, much less being able to call him at any hour, him or her at any hour. So that's the first difference. The second is I do all home visits, so I come to my client's house for every prenatal appointment and every postpartum appointment. They do not have to leave their house, which is really wonderful when you have other kids as well. The other main difference that I like to explain to people, and which they get to know quite well themselves, is it's a relationship. It's not me as the caregiver telling you what to do. It is really a relationship. So hopefully we become friends, and we talk about lots of things, emotions, how things are going at home, how the other children are adjusting. Some prenatals turn into kind of more of a counseling session, really, and I'm used to that. So I take it very seriously that there's a lot of counseling to be done in pregnancy, whether it's something more matter of fact, such as diet and nutrition, which we also counsel about regularly at every prenatal, or just things that come up along the way, a phone call about problems that are going on at home or anything like that. So building the relationship takes time. Prenatals are between 1 hour and 2 hours long, which is also very shocking to people. So, I'm checking up on your diet, as I mentioned, if you're exercising, how that's going, how things at home are going, just kind of seeing how you are and what's new and how you're feeling, and assessing any complaints you might have. Whether it be headaches or back pain, providing referrals to other natural care providers, chiropractors, and massage therapists. What, Rune? What do you need, huh? And then, of course, there's the physical assessment at every prenatal. So I'm assessing you at every prenatal, your vitals, meaning your blood pressure, your pulse, your respirations, your hydration, a urine stick, which gives us some other important information, and just kind of taking that all into account to see how hydrated you are, how well you're eating, how well you're feeling, if your body's showing signs of any pregnancy-related disease, hopefully not, and then assessing your baby in utero. So palpation is often a really new thing to people that haven't had midwifery care. So palpation is actually feeling your baby in your belly from the outside. We've been trained and are skilled at doing this, so we're able to tell how your baby is lying in your body, what parts are what. So I often, take the mom's hands or the dad's hands and put them on with mine. Okay, this is the butt, this is the back, this is how your baby's laying. So we get to know the baby before the baby's born, and it's really fun for moms to know what their baby's doing in there. And often they can tell me, and that's part of it. My baby's kicking here or there, or my baby's kicking more in the front. and I'm able to explain to them how the baby's situated and why it feels the way it does. And then we're assessing the baby's heart rate as well for just normal range. And again, we get to know that baby through each prenatal. What's normal for this baby? What heart rate is normal? So that when the mom is in labor, we are able to take into account what we hear then and kind of assess it with what we knew about the baby prenatally. So again, just to recap, midwifery care is really very different. It's very individual. I treat all my clients differently, really, just based on what they need, how many pregnancies they've had, if it's their first home birth. But I try to treat everybody, of course, with love and respect and lots of attention. Pregnant moms can't get enough attention, so doing the physical assessment and the skills that we're taught as midwives doesn't take very much time, really. I like to spend most of the time counseling the mom, just getting to know her, feeling comfortable in her house, getting to know her family members and who's going to be at the birth, and using that all to our advantage for when the birth actually happens. We're all very well acquainted and a very good team, and those are the most successful births, where the mom feels safe and happy and has somebody she can trust. So anyway, midwifery care in a nutshell for right about now. Want to say goodbye, Rune? Say goodbye? Goodbye. Thank you.